Hello everyone, welcome to a dialogue with Dr. Hema Divakar on this show called Himalaya for Moms. We're going to be talking to you today about before, during and beyond pregnancy phases for the ones who are waiting to become moms and who have already experienced the motherhood and events and happenings around that. And as we go along, please feel free to ask your questions, which we will try our best to respond to during the show, and certainly we promise that we will get back to you even beyond the show. Well, Himalaya for Moms. Is the present day pregnancy an adventure as if you're climbing the Himalayas? It's very symbolic because many who are waiting to be moms are very apprehensive. Rather than the joys of motherhood, they have a lot of stress and anxiety about how will it be and what will they experience, this, that and the other, and you have tons of questions to ask your friends, relatives and doctors as well. So before the pregnancy event, it's better that you have one quick check with your doctor, because there is a pre-pregnancy vitamin that you will be prescribed called the folic acid. And then once you embark on a pregnancy, during the pregnancy, the doctor will do certain blood tests, certain ultrasound scans, this, that and the other, and tell you whether all is well. But you, for your own self, will be having some of the symptoms like giddiness, nausea, vomiting, and something that you can experience and relate to the symptoms and tell your doctor, and they will figure a way around. One of the common things to happen is because of the pregnancy hormones, the dryness of the skin, which gives rise to itchiness. The misconception around itching, especially over your abdomen, is because you itch, because of the dry skin, you may land up with an excessive stretch mark. But let me assure you that there are two simple mechanisms to get around it. One is cut your nails short so that even if you do scratch, you won't hurt yourself. And the second is to use any kind of moisturizing cream. One of the best combinations, of course, would be the cocoa butter, which you would have heard of, which you would have sourced it from overseas in years, but now it's really available in the country, and mixed with glycerin, it really retains the moisturizing effect. And this is one of the simple ways and how you can take care of your skin. Besides this, always the concern will be, can you see the heartbeats on the scan? It is a joyous and an exciting moment. Is the baby growing normally? Are your blood tests okay? The doctor's concerns will be that, do you have a blood pressure? Do you have blood sugar? Is the growth profile okay? Does she need to give you anything beyond the usual iron and calcium tablets, etc.? And lo and behold, the 9 months have gone by, and the great day where you will receive your bundle of joy on your lap is right here. Well, the new kind of problems will perhaps then begin, because the skin is overstretched. It's of course like a stretched elastic. When you release it, what will happen? The tone is lost. So how do you regain the tone? Even here, there are some toning or massage oils which are to your rescue, no matter whatever your mode of delivery is, either the normal delivery or the cesarean section. You can use the toning oils to massage your skin and the muscle toning. And another new exercise that you will have to embark on is to breastfeed your baby. Well, the first week of August is the breastfeeding promotion week, and there'll be a lot of campaigns around that, and you know very well that best feeding for your baby is the breastfeeding. Here again, sometimes small nuances like a cracked nipple or a dry nipple can perhaps interfere with the ease of breastfeeding. Here is where again what will come to your rescue is something which is safe for your baby, something which is like a butter and even a coconut oil preparation, which would enhance the softness of the nipples and help you feed your baby. Well, there is another epidemic which is on the rise in the country, the epidemic of obesity. Gone are the days when you see on the magazine covers emancipated thin ladies in India. Just the opposite is now happening. Maybe it's our lifestyle, maybe the sedentary and the junk food. the calorie in and the calorie out is a mismatch. We eat a lot too much and do not tend to spend the calories. So obesity before pregnancy, excess weight gain during the pregnancy, and retaining that weight beyond pregnancy. So here's one of the questions: how do we take care of obesity during pregnancy? Well, the concept of eating for two no longer exists. Your doctor will advise that the normal weight gain should be 8 to 10 kilos, but if you have a high blood sugar, they will limit the weight gain, in fact, for 6 to 8 kilos only. So you will be asked to take restricted amount of calories. It is always wiser and better to have your weight under control before you embark on a pregnancy. During the pregnancy, there will be a lot of craving, and you will not be able to really restrict the calories as such, but try and do your best. But the important periods for obesity control is before and beyond the pregnancy. How soon can you start exercising during delivery, or after the delivery? This is another question that has come to us, again related to the issues of obesity. Don't let that weight stay on, because all the health problems will magnify with the amount of obesity that you have. At 40 plus, if you are destined to have a high blood pressure or high blood sugar, this will enhance because you are obese rather than lean. So please do start exercising 6 weeks after delivery, no matter whether it was a normal or a C-section. And it is not very important to be very aggressive on your exercise pattern, in the sense that you don't have to visit a gym and sweat it out. The normal routine activities at home, a 15-minute to 20-minute walk, and some simple exercises which either the exercise specialist or your doctor or your mother or friend in the neighborhood who have the experience. But it is important to burn your calories, and it is also, of course, important to pay attention to what you eat and what you do not. If you eat ghee and oil and high calorie stuff, be sure to burn it. There's no excuse for not exercising. In fact, when you're off from your office the first 6 months now, which the extended period of the maternity leave, which has been so kindly granted by our Prime Minister, you have to mark your time for the exercises. Periods are late. How to cope with this? Well, this is Himalaya for moms. And the delayed period, the first suspicion you will have is, have I missed the periods because I'm pregnant? So you will do your urine pregnancy test to confirm it even at home. If your regular cycles are at 35 days, for example, as how this question reads, it is your pattern. Like some of us are short, some medium, and some tall. So the cycle length can be anywhere between 25 to 35, even 40 days. But if it's a regular pattern, so be it. You do not have to manipulate and make it exactly at 28 or 30 days. How do I take care of the pelvic girdle pain? Well, many of you who are on the show today seem to be having many problems that many women around you may have. The pelvic girdle, essentially the region of your hip, it is a wrong sitting posture which usually gives rise to the pelvic girdle pain, lack of calcium and vitamin D3. Most of the women do not intake enough milk or curds. 80% of them are vitamin D deficient. So please do take calcium and vitamin D supplements and also add them on in your diet. Again, the exercising will ease the pelvic ligaments and help you relieve of your pain rather than the rest. So the pelvic girdle pain, if it doesn't subside with these simple messages and instructions that we have given you on the show today, you will consult your doctor, because it may have something to do with your backbone or the lumbar bones and the sciatica or the nerves emerging from the lower spinal canal. There could be a need for an X-ray or an MRI and orthopedic consultation, but most of you will settle with some simple calcium, vitamin supplements and some exercises. Well, going ahead with the apprehensions about the mode of delivery. All of you should discuss your birth plan well in advance, so that right at the end of the 9th month, don't be suddenly apprehensive and alarmed about what's going to happen next. So discuss it ahead of time. Sort out all your concerns and queries. Of course, there is Dr. Google for you to consult in the first place, and many more doubts may emerge as you are going through some literature. What kind of supplementation one should continue post-pregnancy? We've just mentioned that calcium is really important, so is vitamin D3. Many of you who have lost a little more blood than usual will also have what is called an iron deficiency anemia or low hemoglobin. In that case, you will need the iron supplements also. The proteins is definitely a part of overall nutrition or nourishment, and sometimes the doctor may give a formula supply of a high protein and a high calorie supplement, especially for the first 3 months, because you will need to expend a lot of your energy with your sleeplessness, restlessness, the 24/7 job on hand to manage your baby, etc. So you'll need a lot more calories, and iron, calcium, nutritional supplements of protein is the way forward. The BMI is 26. Is it okay to conceive with this BMI? I'm very delighted that somebody has asked about the BMI, which expands as body mass index. What is this? It is the height to weight ratio. The taller you are, you're allowed a little bit of extra weight, but the ratio should fall anywhere between 23 to maximum of 30. 25, 26 is normal. Though we say for the Indian population, most of us are shorter than the Westerners, and 23 to 25 is the ideal. 26, that's the question. Not too bad at all. But if you have crossed the BMI of 30 or 32, it is ideal to work towards reducing the BMI well below 30 before you take up your pregnancy, because obesity itself or pregnancies with high BMIs are shrouded with problems, with early pregnancy abortions and the mid-pregnancy development of issues like diabetes in pregnancy, the increased chances of a premature delivery or malformed babies or operative deliveries, and the other concerns post-delivery, a challenge of actually losing your weight, because how much ever excess has been there before, you have to make a sincere attempt to shed that. Another very common problem and a very important problem. The question reads as, how do I take care of anemia in pregnancy? Well, the message to all the moms and their daughters is, see that you enter the pregnancy in the pink of health. You should get rid of your anemia, ideally, even before you embark on a pregnancy. Check your hemoglobin, see that it's above 11, 11.5, and then you start your initiative for pregnancy. Well, if you've already fallen pregnant and hemoglobin is less than 11.5, then you will need iron supplements by way of tablets, which is a routine supplementation given to every pregnant woman in our country, because that's the commonest form of anemia, iron deficiency anemia, and the B complex of B12. In the food substances, it is the green leafy vegetables. A small piece of jaggery every day will help you reverse your anemia, and the beetroot and stuff like that, which is a dietary supplementation. So if for young girls in the school, we've started giving what we call a chicky, that is a groundnut and a jaggery preparation, which gives both proteins and iron. This is really very good and a simple way of getting rid of anemia before and during pregnancy. Post-pregnancy menstrual cycles are painful. What could be the reason? Well, the menstrual cycles could be painful in adolescent young girls when they start their menarche, or even the first menstrual cycle at the age of 11 and 12. The menstrual cycles can be shrouded with pain. Pain is primarily due to two reasons. One is the cramping of the uterus. The other is because the nature of the uterus itself, instead of being soft, it is a little harder and it causes a little more pain than in the others around you. So the pain is not very special to just a period before pregnancy or just a period post-pregnancy. It could happen to any girl or any women at any time in their lives. There are some simple vitamins which could be given by your doctor to allay this pain, but it's important for you to understand that it is not a disease process, or it's not due to any abnormality that you have pain. Well, do remember that vitamin E, certain antioxidants, some natural food substances, something which you can include in your daily diet will also in an indirect way complement the pain relief as such. We are quite delighted and excited that many questions are coming our way. What foods to give to increase hemoglobin in toddlers? One of the best thing is in toddlers, if you really mean the 3 to 5 year age group or even lesser than that, it's very difficult for me as an obstetrician to tell you what exactly the little children will need, but green leafy vegetables need to be taken in large amounts, and of course the children will not really enjoy it. So it is a small piece of jaggery which comes to the rescue, and the supplements of syrups which are fruit flavor based, like an orange juice. They love to take it, and you must make sure that they have adequate hemoglobin. Advice on hair fall post pregnancy. It looks as though you think everything should happen to somebody post pregnancy. Well, pregnancy is not a disease process, it's quite natural, and it's not necessary that the hair fall should be due to anything that has happened in pregnancy or beyond pregnancy. Of course, pregnancy hormones cause a lot of changes. As we have mentioned before, the dryness and itchiness of the skin, the changes in the nipple that it may cause, the changes in the tone, all of which have some local supplements that you can use to get rid of them. But the hair fall especially may be due to a lack of vitamins, so you need some vitamins to support the hair roots on your scalp so that the fall is minimal. If you have checked your thyroid during pregnancy, and if your doctor has asked you to continue those tablets, and if you suddenly stop them on your own, a thyroid deficiency also can sometimes lead to excess hair fall. So just be sure that there's no medical reason for that. Okay, this is a very basic question. What is a C-section? Okay, just like diabetes, C-section is now a common terminology. C is for cesarean, section is cutting a section of your abdomen or skin. So there are two primary modes of delivery. One is via the natural passage, which is called a vaginal delivery, and for some reason, if your doctor cannot offer you a vaginal delivery, then they will suggest an operative delivery, and that operation is called a C-section or LSCS or lower segment C-section. That is the medical terminology. So C-section just relates to an operative delivery. Cycles are irregular, but no PCOS. What's the reason? Well, again, PCOS seems to be a fashionable terminology. What is PCOS? Polycystic ovarian syndrome. PCOS is polycystic ovarian syndrome. So this is something that your ovary is affected with, there is a hormone imbalance, and you have an ultrasound scan done, and the comment is that it's polycystic ovarian syndrome, and the whole family starts getting worried about it. So the question here is, in PCOS or polycystic ovarian syndrome, we do expect irregular cycles. But I have no PCOS, then why am I having irregular cycles? Well, even without PCOS, there could be a hormone imbalance which gives rise to irregular cycles. There could be obesity, which we have spoken about, which also tilts the balance. Extra number of fat cells in your body will just lock in certain hormones and delay the periods or cause them to be scanty and irregular. Then there could be the dietary factors, the stress, the hectic travel, sudden exercising, sudden stopping of exercises, an array of all of these which give rise to irregular periods. Well, there can be some other disease processes which also cause the irregularity of periods that will need a special check or consultation with your doctor. Well, these are the spectrum of common problems which one cannot escape during the adolescence or their womanhood. Why there is so much increase in diabetes in pregnancy? Well, this happens to be one of my favorite questions because I'm very passionate about tackling this problem on a war footing, because India is only next to China in the number of adult diabetics that we have. China has 100 million, India has 70 million diabetics as on today. Half of them are women and half of them have got diabetes in pregnancy. There's something in the South Asian genes. The Indians are 11 times more prone to diabetes in pregnancy than the other Western countries. It is not a disease of affluence. It is something that is genetic and something that unfolds if the testing has not been done at the right time, if the weight has not been controlled, and if the food habits are making you predisposed to a situation of diabetes. What happens in pregnancy? Why is there a limited time span where your sugars go high? Well, the pregnancy hormones do not allow your body to regulate the sugars as how in the non-pregnant state. What is it that regulates your sugars? It is something called the insulin. If you have any diabetic in your home, you know that they're taking insulin injections. Their body doesn't produce enough insulin, so they need an outsourced insulin. Similarly, in pregnancy, whatever the insulin the body is producing, these pregnancy hormones are fighting with that. They're not allowing that insulin to do its job. They're interfering with the insulin action, and thereby the sugar control tilts the balance. So every single pregnant woman needs a check for their sugars in pregnancy in the early part, and even if that is negative, in the mid-pregnancy, they must have this check again. I'm a carrier of thalassemia minor. What precautions should I take for my daughter? This is again a very serious and a very important question, because in the present day, especially in the metros, we do a test called hemoglobin electrophoresis for all pregnant women, as commonly as we do the hemoglobin check, as commonly as we do the blood sugar check. We also do the hemoglobin electrophoresis because we want to find out if this woman is having a thalassemia minor. Because if you're born with thalassemia minor, you will have the normal adolescence and adulthood, and there's no problem unless the partner or the husband also has a thalassemia minor. So when a lady undergoes the hemoglobin electrophoresis test in pregnancy and she's detected as thalassemia minor, you have to check the husband's hemoglobin electrophoresis as well. If he is also a thalassemia minor, this minor and this minor in combination can give rise to a child who may have thalassemia major, and then the problem begins. So if your husband is not a carrier or he's not a thalassemia minor, you don't have to worry about the well-being of your daughter. All that you've got to do is test her blood and for a test called the hemoglobin electrophoresis. Make sure whether she is a carrier or not. There is a good chance that she may have a normal hemoglobin electrophoresis, in which case you have nothing special to do. But if she is also detected a thalassemia minor like you are, then even before she gets married, be sure to check the partner's thalassemia status, and please do not encourage the marriage between two thalassemia minors. That is the only long-term precaution that you need to take. So this needs a little more in-depth interaction, and maybe we will cover it in one of our subsequent programs on Himalayas for moms. So you please recognize that yes, as how climbing the Himalayas, this journey is tough. It is an adventure indeed, but at the end of it, there is so much joy because there is so much available to you in terms of facilities, knowledge and information. So do be wise to interact with your doctors concerned or with us on this show of Himalayas for Moms, and you will definitely stand to understand better than what you are. Would you recommend a painless delivery? Yes, gone are the days where we say Meeta Meeta Dard or the joys of motherhood. Every lady recognizes that the delivery pain is quite intense, and it is not easy for anybody to bear the pain if they have a choice of a painless delivery. Discuss this ahead of time with your doctor. Epidural anesthesia is what we offer, and it is called a painless delivery because once you are dilated up to 3 or 4 centimeters and you start getting strong uterine contractions. You have already discussed with your doctor. They will offer you epidural analgesia and the rest of the process without a problem, without a pain, you can deliver safely. By when should one come back to normal weight after pregnancy? 6 weeks is the time where you are given the liberty to be as how you are. 42 days to be precise. You go back to the pre-pregnancy state. That means all your pregnancy hormones which are circulating in your blood disappear from your blood, and then you have to, your system is back to normal. So it depends on how much weight you have gained during pregnancy. You have to necessarily shed all of that as early as possible, because the best time is the first 3 to 6 months, because once this weight stays with you, believe me, it is very, very, very difficult for you to shed it later. How do I get pregnant with irregular periods? Well, irregular periods does not translate into irregular ovulation. If you are releasing your eggs on time, if you are ovulating, you may not have much problem in getting pregnant. Please do consult your doctor, because they'll do certain hormone tests to confirm, and they may do what is called a follicular scan to confirm whether you're ovulating or not. You may need some help with some drugs called ovulation inducing drugs, and it may not be all that difficult for you to get pregnant even with the irregular periods. How safe is yoga during pregnancy? It's not only safe, but it is effective. It is recommended not only for a physical form of exercise and to ease your ligaments, but also for de-stressing. There are general yoga and the therapy yogas, because if you have high blood pressure or high blood sugar in pregnancy, yoga therapy goes a long way in ensuring adequate supply to your baby, in de-stressing and getting your sugar levels down, and of course making you feel a lot more better physically and mentally to endure the stress and strains during pregnancy and during delivery also. How safe is VBAC? It looks like a very enlightened crowd, because what is minor thalassemia, anemia, VBAC, PCOS? These are the terminologies which we as doctors would think would be a technical jargon or something strange, but we are quite happy to get these very words from those who are watching this show. That means the background of this enlightened audience is indeed to be appreciated by our community here at Himalayas for Moms. VBAC, VBAC means vaginal birth after cesarean section. Well, here again you will need a detailed discussion with your doctor. We can't call it safe or unsafe. It is a process of trial of a vaginal birth after you have had a previous cesarean section. The reason for an extra caution being your uterus is now a scarred uterus. It's like any bag which is torn, which is sewed up, and if it is stretched and it's heavily contracting, there is a chance that the area where the stitches are may give way, and this is dangerous both to the mother and the baby. So if we are giving you a trial of VBAC, first of all it depends on why the first cesarean section was done and whether it's the same reason where the next time also the doctor would opt for a planned cesarean section before you get into any complications or any trouble. If not, if it is not a repeated indication, then you may discuss the safety and the possibility of a VBAC. Be sure that you need a complete supervision in a center which has excellent facilities for shifting you into the operation theatre at the drop of a hat, because if there is an emergency situation where they recognize that this woman who is undergoing a VBAC is now in trouble, within minutes we have to pull out your baby by yet again offering you a C-section, which you are now well versed in, cesarean section, as we have explained to you earlier on this show, that this is what you will understand about VBAC. So not that it's a bad thing, not that it's an unsafe thing, but it has to be in a facility which has an excellent infrastructure and the human resource to monitor your labor and to act upon a complication if it does happen. With this, we come to the end of today's interaction on Himalayas for Moms. We would be quite excited and eagerly looking forward to meeting all of you, your friends, and many more in the community for the moms to be who we would like and love to interact with and exchange some deliberations which would empower you with the necessary knowledge and wisdom to make your own decisions on your own reproductive health, because we strongly believe that your health is in your hands. Thank you very much for being with us on the Facebook Live on Himalayas for Moms.